Point-of-care testing is an integral part of medicine. It enables simple, automated testing that yields fast results. Hospitals have also started to increasingly use POCT diagnostic systems over the past few years. We are guests at the Greifswald University Hospital, where patient-side rapid diagnostic tests have already been successfully integrated into daily hospital operations.
Hier auf der Intensivtherapiestation haben wir es mit vital bedrohten Patienten zu tun.
We treat patients with life-threatening conditions here at the intensive care unit. The faster we're able to make a diagnosis and determine which finding is right or wrong, the sooner we are able to respond and choose the right treatment. In intensive care, we refer to this as the so-called golden hour. That means the first hour of treatment is crucial to impact survival.
Das heißt, die erste Stunde der Therapie ist entscheidend, das Überleben zu beeinflussen.
Point-of-care Teste werden in der Nähe des Patienten.
Point-of-care testing is performed in close proximity to the patient. Samples, such as blood samples for example, are collected from patients in the usual fashion and are then analyzed nearby. The analysis is typically done by the ward staff and not laboratory personnel. Even though the term point-of-care testing, or POCT in short, is often used, it's more accurate to call it patient-side rapid diagnostic testing, as indicated by the guideline of the German Medical Association on quality assurance in medical laboratory examinations to set up clear quality assurance requirements.
Die Vorteile sind, dass wir wirklich zügig arbeiten.
The advantages are that it allows us to work fast. We have a prompt diagnosis. Our clinical suspicion is either very quickly confirmed or we're able to dismiss it. All this enables us to very quickly start the right treatment at the right place. But speed isn't everything. Wherever a lot of data is being generated, it also needs to be used sensibly in point-of-care testing. This is where a great IT department can assist physicians and staff.
Also letztendlich geht es darum, einen Gesamtprozess abzubilden.
Ultimately, the objective is to map the overall process. It's not just about having test results on the device, but also about transferring patient data that originates in the medical information system to the device middleware. This lets the device determine which patient we're dealing with, his or her name, first name and date of birth. All this has to return back into the laboratory information system along with the sample and ultimately also back to the patient's bedside.
Und dann letztendlich auch wieder zurück ans Patientenbett zu bringen.
A well-structured concept is required to ensure an optimal process and streamline processes as much as possible. The applicable devices should also be standardized. This is crucial for staff training, for example.
At
the Greifswald University Hospital, we try to offer as much patient-side rapid testing as needed to guarantee excellent patient care, but also as little as possible. You have to remember that this requires us to train many designated device users to ensure reliable processes. And that's also why we always like to offer just one type of device per model. That way, we don't have to train staff in the use of many devices, but only one standard device to perform a blood gas analysis, for example. Here at the Greifswald University Hospital, we mainly provide blood gas and blood glucose analysis near patients, but we also perform troponin tests at the ER and coagulation tests such as INR in our stroke unit. Many POCT systems are already firmly established and their benefit for patients is not called into question. However, new developments in this field need to first prove medically beneficial. And there's also always the question whether it's ultimately still more expedient to perform a test at the central laboratory. The challenge with patient-side rapid diagnostic tests is always to strike the right balance between the innovations that tests offer and what truly warrants a patient-side rapid diagnostic test. In the case of blood gas analysis and troponin tests, it's obvious that results are needed immediately. Meanwhile, new tests on the market first need to be assessed. Are they really beneficial in terms of speeding up the treatment? Do they have to be performed near the patient, or would it perhaps be better to perform them in a central laboratory? Patient-side rapid diagnostic testing and laboratory analysis, as centrally provided in hospital laboratories, for example, sensibly complement one another. That means both concepts must always be synchronized. Methods have to be comparable to obtain the same patient test results and avoid differences due to the use of different methods. However, the motto for POCT concepts is not one size fits all. Hospitals have to pay attention to a number of things in order to integrate such a concept into their everyday business, as Dr. Petersman knows. It's important to analyze the setting you're working in very carefully first. Is the clinic in a rural area? Are you in an urban area? How quickly can company technicians be contacted, or how quickly can they reach the location? It's important to know the requirements profile. What kind of analytics do you need? There is no concept that's always suitable for everyone. It should always be adapted. I don't recommend the same concept for everyone, but rather recommend considering which analytics you really need. Only these should be introduced and integrated into the hospital's IT landscape. For example, the hospital information system and the laboratory information system.